Good morning, colleagues and friends. I am Dr.Vinoo Mathew from Aspen Dental Polyclinic. As we all know, we are going through an unprecedented time with COVID-19 infection. Dentistry is one of the gravely affected professions. In this video, I would like to share with you some of the measures and protocols we as dentists can adapt into our practice to make it as safe as possible during the post-COVID era. It's established that SARS-CoV-2 virus is transmitted through aerosols, droplets and splatter, and that's our peril. Active dental procedures actively create all three of these, and that makes dental profession one of the most susceptible in the entire medical field to contract the disease.
In the World Economic Forum's occupational risk force for COVID-19, it is shown that dental hygienists, dentists, as well as dental assistants figure close to 100% risk score.
With 30% of asymptomatic patients in the population, it is just a matter of time one of the COVID-19 patients sits on your chair. So how can we help ourselves? We have to change the way we practice as much as possible in the safest way to counter this. For this, I have subcategorized the protocols into 4 points: immunity quotient and viral load, screening and testing, advanced PPE, aerosol limiting measures. The first point is the immunity quotient and viral load. Susceptibility to COVID-19 infection is a balancing act between your immunity and the viral load you are exposed to. So to be safe, you have to increase your immunity quotient and decrease the viral load. Increasing the immunity is not a topic that I am going to, because all of us from the medical profession are aware of and are knowledgeable to it. Decreasing the viral load can be done by actively reducing the number of patients that you see per day, and also giving space or time in between appointments. Having a break day after 3 days of consecutive work will be another option. Second point is screening and testing. There should be absolutely no walk-in patients. All patients have to be appointment based. 2 days prior to the appointment, from the clinic, we need to make a phone call and make a questionnaire which the patients will answer. At Aspen Dental Polyclinic, we made our own questionnaire for COVID-19 and also a consent form for it. I am displaying what we have in our clinic, which in detail goes into questions, and the one who is booking the patient will definitely record those answers from the patient and will determine whether that patient should be given an appointment or not. The questionnaire gives us a safety for the patient. Then we will confirm the appointment and inform the patient that on the day of their appointment, they will have to sign a consent about all the things they answered in the phone questionnaire. Government guidelines mandate all people to wear face mask when they are outside. If a patient is coming to the clinic without wearing a face mask, that shows they are very non-compliant patients and we don't want them in our practice. Try to avoid them. The clinic receiving area of the patients should be clean and uncluttered as possible, which will enable for better disinfection and sterilization procedures. All staff should wear proper PPE while receiving the patient. The clinic should have a PPE station for the patient where they will be given the appropriate PPEs. If clinic has the facility, it would be better to ask the patient to wait in the car till we are ready to receive them. As the patient enters the clinic staff will record the temperature using an infrared thermometer and will guide them to the PPE station. At first, they will be asked to sanitize their hands and a hand glove will be given. Subsequently, a head cover, and also after disinfecting their footwear, they will be provided with a shoe cover. Patients are instructed to wear all these PPE as long as they are in the clinic. Once they leave the clinic, all these PPEs can be discarded and put inside the medical waste bin which is provided.
Patient PPE station will be disinfected by fogging and wiping using sodium hypochlorite solution after each patient.
Third point is the advanced PPE. Dental clinics by and large had very good disinfection and sterilization procedures and staff PPE before itself. We had better PPEs compared to our peer medical OPs. So what we really need to do is to add some advanced PPE to our already existing robust infection control procedures. In the post-COVID era, it is advisable for the dental clinics to have a separate consultation room for doing non-aerosol generating procedures and a well-equipped another room to do the aerosol generating procedures. The consultation room can also be used for donning the PPE for the staff before they embark onto the well-equipped aerosol generating room. Since SARS-CoV-2 virus is a respiratory pathogen, I would like to go a little bit detail into the masks and the respirators available for us. Before I go into this, I want to make one point very clear, that any information I share with you are not in any way part of any guidelines by the health authorities or any governing body. These are my own personal interest into which I went into, gathered information from around the world, and also based on the guidelines by CDC and OSHA's latest updates. Okay, coming back to the virus. SARS-CoV-2 virus is known to be 0.06 microns to 0.130 microns inside. Now, none of the filtration systems in the world available to us at the moment can filter that. But fortunately, the virus doesn't transmit by itself. It needs a medium. And normally, the medium we have is aerosol, droplets or splatter. The size of a minimum aerosol particle is around 0.3 microns, and fortunately we do have something called as the filters or HEPA filters, HEPA 13 and 14 precisely, which will be able to filter 0.3 micron sizes. So let's see what are the available masks we have. First of all, what we have is a surgical mask we are all familiar with, which is a 3-ply mask with a filter inside, which will be worn through the ear loops, and this will be quite good enough for doing any non-aerosol generating procedures. Is absolutely fine. Next comes the next level of it, which are the N95 masks and the respirators. If you are going to do a aerosol generating procedure, then the CDC guidelines advise us to use a N95 mask onwards. It's an advice. If you don't, it's difficult to procure these days, but if you can get one, it would be advisable to do that. So, out of this mask, we have the normal N95 mask, which is the NIOSH certified one. The NIOSH certified N95 mask means it is certified by the National Institute of Occupational Health and Safety. And there is something called as the KN95 mask, which is from China, which is also equally good, but it doesn't get certification from NIOSH. What it does is, both these masks filters particulate matter up to 95%. While when you're going to look into the other two masks, which we have the respirators, which uses what we call as a filtering mechanism. So these filters are put on either side of the mask, and there are different kinds of filters available. One good advantage about the mask, they are reusable and the filters can be changed. There is a little bit confusion regarding these names because it's N95 or that is an American specification, and we do have something called as FFP2, this is a European specification. Either of these masks will do. There is one more category in this, which is the N99, or they call sometimes N100 and FFP3. Those masks will filter up to 99% of the particular matter. But coming to this mask, these masks are filter based and they filter 99.97% filtration of the particulate matter. So let's look at practically. If you have an option to secure N95 masks, it is very good to use them. But as you know, this is a long haul it's going to be, and N95 masks are something which is quite expensive and also cannot be reused. So We have a better option with these respirators because they can be reused. So in a clinic setup for the doctors and the nurses, to use a respirator would be much better than going with an N95 mask. So these respirators comes with two kinds of filters. One is the P100 organic filter. It is a very good filter, but the only problem is we cannot touch the side of the filter, and the filter has to be changed at least in 2 weeks' time. While the other filter is something called as a 7093C NIOSH approved HEPA filter, and these filters are concealed. It's very good to use. There is no problem in touching the surface, and also this lasts for almost 6 months. One more point here to notice is that all N95 masks have to be fit checked. When you're wearing it, there are two kinds of strings. One, it goes back to the head, and this goes into the ear. Both has to be fit checked well to use. While these masks have an advantage that it can be fitted using these strings wherever it is available, where you can tighten them, and these margins are silicone, so it's very comfortable to wear, and it gives you a very tight fit. So the advantages for the respirators are, first of all, they are reusable. They are more safer because the filtration is around 99.97, and these filters are have to be changed only in case of HEPA filter only 6 months time, so it is more economical. And also, because they are having the silicone borders, it is much more comfortable. Along with the mask, one more thing what we need would be to protect our eyes. So we need to wear something called as a visor on top of this to give you protection from any splatter, and this is also part of the PPE what we need. So now I would like to take you to one grade higher, which is a product called PAPR, or Powered Air Purifier. This is just for your interest sake. It's none of the guidelines require for you to do this, but I will explain to you why I personally preferred this. As you know, as dentists we do long procedures, and if one of you have worn an N95 mask for a period of more than 20 minutes, you would have realized that how difficult it is to breathe through them. So the filtration system becomes safer and safer. It becomes laborious to breathe. So any of the respirators or the N95 masks are not comfortable to work for a long period of time. Here comes the Powered Air Purifier's advantage. This is from 3M, which is called as a 3M VersaFlow TR300. It has a body which is going to do the filtration, which has a HEPA filter and a battery powered air transmitter. So what it does is it collects the air in the room, filters it through the system, and it takes it through this tube into the hood. Another problem most of the dentists face is regarding the use of magnification loops. So if you're using any kind of respirators or any kind of a N95 mask, wearing the loop and the light plus the visor becomes a problem. Here, using this, we can circumvent them. The loops can be worn inside and a light can be fitted on top of this. Other problems normally is the fogging of the visor in between the procedure. That makes it very difficult for visibility for the dentist. Since the air is coming as a positive pressure into the hood, the entire time you don't have any kind of fogging, and it is very comfortable. Whatever the ambient temperature in the room, that temperature of air will be pushed into your hood. One more point which I have personally encountered wearing the respirators or any N95 mask are the difficulty in communicating with the patient. The communication with the patient becomes quite difficult because the sounds are quite muffled. Okay, now you can see that I have put the loops on, magnification loops on, and I have fastened the respirators battery and as well as the filter here with the belt, and I'm going to put this on. Once it puts on, it's going to take the air from the room, filters it through this tube into the hood. So I'm going to wear the hood. So you can see now the hood is on, and I'm going to put the light on top of it. This is something that I managed to do it by myself, and this solves my all problems of working for long period of time. I don't have any issue in communicating with the patient. You can clearly hear what I am saying. I have the loops, I have the light, I have no hindrance in my vision, and I have 99.97 protection, as well as it's very lightweight, and for walking for long period of time, this suits very well. PPE for a non-aerosol generating procedures are shoe cover, gown, gloves, surgical mask, and the face shield and head cover. PPE advice for dentists for aerosol generating procedures are shoe cover, double layered gloves, gown, the face shield, respirators, eye protection, and head scarf. Here you can see very well that it is difficult to put a light here, and also fogging of the visor is a problem. In the alternate case, if you are using the powered air purifier, you can see the face shield is already there. There is no need of a mask there. Lights can be mounted on top. It's very free. It is 99.97 protection. The fourth one is the aerosol limiting protocols. Here what we need to do is to limit as much as aerosol exposure to the staff and the patients, thereby reducing the viral load. This has to be done by using many steps which will cumulatively help us to reduce the aerosols in the room. These steps are: before the patient starts the treatment, we ask them to rinse their mouth with 1% hydrogen peroxide or povidone iodine for 1 minute. This will reduce the viral colony in the saliva and the mouth. The second step would be, if the procedure permits, use rubber dam or isolate kind of isolation systems or techniques with high vacuum suction to reduce the aerosol. Third step would be to use an electric motor than an air turbine. Even though we don't have evidence for this, definitely an electric motor will have higher torque and less splatter compared to an air turbine. Fourth step would be to use an extraoral suction. There are many companies coming up with this. One is from Eden Medical, Prime Medical, and City Pharmacy. The one important thing that you should look into would be to have some kind of filtration system available, minimum of an HEPA 13 or a UV filter. Fifth step would be to use a medical grade air changer. Don't confuse between the normal home air purifiers to this. The difference is that medical grade air changers should have a HEPA 13 or a 14 filter, and also they should change the air in the room minimum 5 times per hour. There are two companies which are renowned for doing it in the world. One is IQ Air from Switzerland, and the second one is Blue Air from Sweden. Sixth step would be room ventilation, room fogging, or fumigation. If the clinic has an outside window, after each patient's finished, it is better to open the window for 10 minutes. Or you can use room fogging with sodium hypochlorite solution. Fumigation can be done by hiring a fumigation company which will come and do the clinic fumigation at the end of each day. There are a lot of companies which will do it as a contractual basis. Here we demonstrate the use of multiple protocols in an actual clinical scenario to reduce the aerosol generation in the room. Excellent use of four-handed dentistry with retraction, isolation, and high vacuum suction, and the additional extraoral suction to reduce the aerosols, droplets, and splatter. We already have robust infection control procedures in the dental clinics. The dentist and the dental assistant are donning the advanced PPE for their protection against the COVID-19 infection. The room air is filtered and changed 5 to 7 times using an HEPA 13 Blue air changer. Also, after the procedure, the clinical room the windows can be opened and to allow for a cross ventilation. Room fogging after the procedure is an additional protocol which can reduce the room contamination. The surfaces should be properly put with barrier membranes, especially the computer keyboards and the mouse. If you are using any kind of equipment or machinery, should be properly protected. And this is the HEPA 13 filter from Blue Air, which is going to change the air 5 to 6 times per hour. And all the surfaces on the machinery are covered with barrier membranes, including the X-ray tube. After each patient is finished, we need to have a minimum of 15 to 20 minutes, maybe up to 30 minutes of gap till we do the complete disinfection procedures to start off with the next patient. So by combining all these steps, we can limit the aerosol exposure, thereby limiting our viral load. Colleagues, the coming days are going to be very challenging, both professionally and economically. Please follow the government guidelines for your practice. If you have any questions or doubts, please feel free to contact me in the following numbers. Thank you all and stay safe.